I'm Dr. Deepak Chabra, consultant cancer surgeon at the prestigious Lilavati Hospital and Research Center at Bandra in Mumbai. I'm here to discuss with you today and give you some awareness about stomach cancer. We often complain of pain in the stomach. What exactly is the stomach? Stomach is nothing but an organ in our abdomen, and this particular organ is the place where the food gets stored temporarily for some amount of time to be passed on further down for our digestion and for our nourishment. This organ can get affected with cancers. We are seeing many young as well as elder people coming with symptoms of stomach cancer. So what are these symptoms? Common symptoms are acidity, heartburn, indigestion, which we all probably feel at some point of time. But the problem is that we neglect these symptoms when it stays for a longer period of time. When these indigestion, acidity don't get treated with routine medicines, especially if you start feeling a little loss of appetite, if you also start losing weight, and that is, you also probably are having a little bit of blood loss which goes unnoticed in your motions, and you have probably black colored stools. These can all be symptoms of stomach cancer. So be aware about it. How do you know that you've got stomach cancers? Obviously, the doctors are there to help you out. They will run a particular set of tests to determine whether you're suffering from any of these. But what can we do as people to prevent and to be aware about stomach cancers? Which means I'm talking about what could cause stomach cancers. What we know is there can be a long-standing infection of Helicobacter pylori, which is the commonest cause for stomach cancers. But this is also what is called our normal bacteria in the stomach, which get altered with our dietary habits. A lot of spicy food, a lot of smoked foods, a lot of seafoods, and such junk foods can probably destroy the lining of our stomach and alter the internal environment of our stomach to give rise to cancers. Added to it, there can be a sedentary lifestyle, obesity, stress factors. These are all risk factors where we can get a high incidence of stomach cancers. More of smoking, more of alcohol. These are again two strict agents for stomach cancers. So what we need to do to prevent is to have a healthy lifestyle. To prevent ourselves from getting into stomach cancers, we need to have a little workout. We need to eat fresh, healthy foods, healthy fruits and vegetables. We need to quit smoking. We need to avoid alcohol. Now coming down to treatment, what are the options of treatment? As I always say that the eyes don't see what the mind does not know. So you need to be aware that the treatments are there for stomach cancers. That means once you get it, everything is not at an end. But for this, we need to detect your cancers early. And once it is detected, generally the treatment forms, people are often scared about surgery. I don't think you need to be scared about surgery. You've got to understand that once you develop these cancers, there is definitely a treatment for it. The treatment of stomach cancers generally falls into two categories. One is either chemotherapy or surgery, but more of surgery is the backbone of treatment where some portion of your stomach is cut and joined back. We often wonder that if our stomach is cut, how would we be able to eat? I don't think that should be a worry. People are generally eating normally. You can have anything and everything that your doctors will guide you. But the whole point here is not to get to that particular stage of getting into treatment of stomach cancers if we can prevent it by having an understanding for it. Thank you.